Hello, everyone. My name is Dr. Kundlas, and I'm a primary care physician in Central Florida. Thank you for joining me on this topic about managing common winter illnesses in 2024. And let's discuss how we're going to proceed. First, I will go through why it's important to take care of yourself during these winter months and what are these preventive strategies. Then we will go over each disease which is relatively more prevalent during winter months, and then we will go through preventive strategies, what we could do, and then we will take care of the practical tips and vaccinations. That way we are enjoying the things and remaining healthy. So let's first understand the disease burden during winter. Winter brings a very unique situation where not only we are in close proximity to each other, we are in our social environment, we are constricted, so we are in more close contact. What that means is that you will be able to have increased chances of getting together and in close proximity more frequently during winter months what you will be during summer months. In summer months we are all scattered. If I have some bug and if I'm coughing out and creating droplets, which are, you could inhale those, or I'm doing it on some kind of furniture or this thing and they settle down there and you touch it, and you will be getting those infections or problems more frequently what you will do during winter months. During winter months, other main thing is that there are certain disease pattern which evolve, and during winter months you will find viral illnesses are more common, and then you have increased propensity, and also there is increased chances of having more of depression and more risk of heart attack during winter months. Viral infections. Most common viral infection during winter months are four. Number one, common colds. Number two, respiratory syncytial virus. Number next is flu. And the last one is now, which is emerging and becoming a bigger healthcare threat, is COVID-19. So when you combine these four most common viral illnesses, they pose a significant risk to our seniors because they lead to more chronic medical problems, hospitalizations, and death. At once you cross 50, and especially when you cross 65, and if you are not fully vaccinated, you cannot ignore these illnesses. Let's take up common cold. Common cold is just a virus. The group of virus which give you is a rhinovirus. And to understand this whole perspective is, let's look at through your body. You have an upper respiratory tract which involves your nose, throat, and upper throat, sinuses, which will make upper respiratory tract. Then is your windpipe, then bronchi and lung that we call lower respiratory tract. Common cold is primarily a disease of your upper respiratory tract where you could have runny eyes, your nose will be congested, throat will be congested, you could have a little bit of aches and pains, and a lot of steering, a lot of coughing can happen. But this virus is very self-limiting. You have to support yourself, take symptomatic treatment, and then you will find within a couple of days it start wearing off. If you get exposed to this common cold or rhinovirus, it will take about 1 to 3 days before you start getting the symptoms. Then they last for, from depending on your physique and your medical condition, they last from 7 to 10 days. Yes, they don't kill you, but they make you miserable. Next common continue on the viral illness is your RSV. Again, we do not have any good way to prevent RSV infections up till recently. Now we have a very effective vaccine. Everybody above the age of 60 should have it. It's a one shot, and then once you get it, it cut down your risk of acquiring this RSV infection by almost 90 to 95%, which is a big plus. Why this thing is important? RSV not only give you symptom of your upper respiratory tract, it goes into your bronchi and lungs, can make you short of breath. And if you have other chronic medical problems, diabetes, high blood pressure, kidney problem, liver problem, COPD, asthma, you will have increased risk of complication from this RSV. If you're a healthy 65, RSV may not bother you, but if you have any of those conditions, it will bother you. So consider taking RSV virus vaccination if you are above the age of 60. It's not approved yet for the less than 60. How we diagnose RSV? It's a simple nasal swab. If you go to your doctor, they will take a sample from your nose, and then in the secretions, we could pick up PCR, we could pick up the antigen which is present or not, and we should be able to tell it. Again, most of the time, unless you are very severely getting complications from this thing, we usually do not treat RSV with antiviral medication, but there is effective antiviral medications available which will help you. Next on the list is flu. The question always comes in, like, we as physicians also get tricked, like, how do we differentiate between a common cold, how do we differentiate between RSV, flu, and COVID? It's like certain pattern in healthcare. What we do is, based on your history, we make intelligent guesses after examining you. Flu has a little bit of characteristics which kind of differentiate from common cold and RSV. Is a it like RSV, it can involve your upper respiratory tract and also your lower respiratory tract, but it can give you a lot of other symptoms. It can give you a lot of aches and pains. It can give you a lot of muscle pain, because that is the one of the fundamental thing, is that it gives you a lot of muscle pain. If you are having a lot of back pain, leg pain, achiness, and high grade fever, and then the duration, if you acquire it, the duration is very small. You pretty much get, if you get exposed today, between 1 to 2 days, you will start having the symptoms. So that makes it very unique that you will get this with the flu. Again, prevention is, we get vaccination for that. And the best time to get a vaccination is in last week of September or October, because then you are protected for your winter months. Then the next viral infections is the COVID-19. COVID-19, we pretty much exactly present like it will have all the spectrum of the symptoms, but upper respiratory and lower respiratory, you may have sore throat, you will lose taste and smell, and then if it gets into your lungs, it can give you difficulty breathing, coughing, wheezing. All those things can happen with you, and then you could have these things. Again, prevention lies in vaccination. We understand that we all have opinion about COVID-19 vaccine, but as we are talking at this time, it is proven over and over, COVID-19 vaccine is about 95% effective in preventing you getting sick or acquiring the disease, and definitely preventing hospitalization and death. So it's the only tool which we have. If, God forbid, you acquire COVID-19, we do have very effective medications, whether you are in a hospital setting or outpatient setting, Paxlovid, Remdesivir, and there is another third one. All three are very effective and they will help you. This day and age now, knowing with all the research and everything what we have gone through, unless you have other complicating effects that we should go through any kind of complication or death based on COVID-19. But my goal is not to convince you to get COVID-19 vaccine, but I definitely want you to make your opinion on this one, is try to take the vaccine, try to improve your chances of fighting this deadly illness, because there is no reason that we shouldn't do that part. Next, the viral infection is a norovirus. This norovirus is the one which give you diarrhea, abdominal symptoms. It's usually very self-limiting and forgiving. If you look at the common theme, we starting with the common cold, RSV, flu, COVID, and noro. In all of them, your main thing is you need to keep your body hydrated, take symptomatic treatment. If you're running a fever, take Tylenol, eat good, and protect yourself from others and protect others from you by masking up, washing your hands, and do this part of it is. And your symptoms will pretty much will depend on whether it's upper, you primarily having a more of upper respiratory tract symptom or lower respiratory tract system symptoms. But we do have very effective and good medications available which will help you to continue to get better with that part. Then, what are the other unique things which happen in winters? Remember, when we are cold, our muscles are contracted, you will have more of arthritic pain. And then, if your balance and the joints are not moving flexible, pliable the way it should be, that increases the risk of slip and falls. So, there are more falls which are reported during winter months rather than summer months. We should always be careful, but as we are talking, for discussion, the falls are more common during winter months than this thing is, which leads to lot of falls leading to fractures, ending up in a hospital, nursing home, and many seniors do not make it out of these settings, whether it's a hospital or nursing home. So protecting ourselves and preventing falls is very important during winter months. Next topic which we want to do that is, if we don't have a proper sunlight, especially in the states where in Florida we are blessed, we have sunny day most of the days of the year, even during the winter months. But in other states, when this thing, expose yourself to bright light, because that affects your mind both emotionally and intellectually. People tend to get more depressed during winter months than during summer months because light is very important for your mood. So expose yourself to light, expose yourself to how this thing is going for your mental health. Light is very important. Further, because of the cold, your blood vessel goes into spasm, there is a less blood circulating, there is a propensity to have increased risk of heart attacks during winter months. So in nutshell, what a message which I want to convey, that how you prepare yourself during winter months is: A, make sure you do vaccinate yourself, and I'm going to go over in the end, go over all the vaccines which are recommended for the 50 and above, and also for our seniors. Second is, make sure your home environment is safe to prevent falls, and then also make sure you take all your medications. Before we go further, I truly believe you should have certain things at home available to help you with that. Those will be: make sure you have Tylenol at home in case you develop any cough and colds for aches and pains, which you do this one. Then some cough medicine or at spices like ginger, they all are shown to help treat your symptoms. Prepare yourself, this one is. But the biggest preparation should be vaccine. So we're going to talk about 4 vaccines today. Currently, as we are talking, everyone should have flu shot every year. Number 2, RSV if you are 60 and above, only one time. Then third is the COVID-19. As per the COVID is a very tricky disease. The virus keep on mutating every 3 to 6 months, the virus changing. But with the mRNA technology, they are able to keep up with the virus now. But even if the virus is changing, but we have been vaccinated, that your body will immune system will have the memory to fight the new variants of COVID-19. So it's important that you are vaccinated. And the fourth vaccine is a pneumonia shot. So make sure you get your pneumonia shot. There are a lot of different recommendations and it comes into multiple ways, but you should get polyvalent 23. If you're 65 and above, you should have one shot at least. And if you have other chronic medical problem like a lung problem and other diseases which will lower your immune system, your doctor will guide you if you need it more frequently. So if you take 4 vaccine, keep your home environment safe, and then when you go out, I think you will improve your chances of not getting any kind of extra exposure or extra risk for winter illnesses. Thank you very much.